Hi everyone, my name is Abigail Sharon, and today I'm going to talk about the nursing documentation. I choose the simplest method of all, which is narrative documentation, which make a storyline of what happened to the patient and the condition of the patient. So I'll share my screen off, and here we go. This is my nursing documentation example. The date and time, 2nd December 2022, 1 p.m. in the afternoon. The client stated, I can't hardly breathe. The respiration rate is 30 times per minute, blood pressure 110 per 70, pulse 110 times per minute, oxygen saturation 92% on room air with an oxygen nasal 2 liter per minute. Skin is pale, cold, and dry. Lips dry and also bluish, which is cyanotic, shows that it lacks of oxygen. Nail also cyanotic, lack of oxygen. Capillary refill time more than 3 seconds, which is not good. Client was using her respiratory muscles during inhalation, which shows that she can't hardly breathe. An auscultation sound, wheezing and ronchi, much sputum at both left and right lungs. This is the condition of the patient before the nurse giving an intervention. And the nursing diagnosis here is ineffective airway clearance. So the nurse will later give intervention, sort of that things, and see what the client will what the condition of the client that going to be better after the intervention and implementation. So next, after the nursing diagnose, the nurse write again the documentation that the client was elevated 45 degrees semi-Fowler, and the nasal oxygen was removed, and Ventolin plus Pulmicort was given through a nebulizer. So it basically like the patient getting a nebulizer treatment. Then after 15 minutes, the client was able to vomit out sputum. The respiration rate decreased into 22 times per minute. The blood pressure becoming 120 per 80, which is normal. The pulse become 95 times per minute, which is normal. Oxygen saturation becoming 96 percent without oxygen nasal, which is great, which is normal. And the skin getting warm, lips and nail pale pink, which is better, and the capillary refill time is less than 3 seconds. And the wheezing and ronchi still appear, it's still there in both lung, but client stated, I can breathe much better now. Then the nurse left the client in a 45-degree semi-Fowler position. This is one of an example of a nursing documentation in narrative form, which is very easy, which you just can make a storyline about what happened to the client, what's the nursing diagnose, and what did you do for the client to make them better. And finally you can write the evaluation of the patient after you give some sort of implementation and intervention. And don't forget, at the right side we have to write our name and also sign, because it's really important in the nursing documentation, sign and name, so that people know who write this, so that people know who is in charge of making this documentation. So yeah, that's basically how a nursing documentation in narrative form um going on, something like this. And yeah, I hope you understand, and I hope you can be educated by what I have just told you guys. And yeah, this is pretty much that I can say about nursing documentation in narrative form. So I'm just gonna stop my share screen, and hopefully that me as a nursing student also can improve better in making a nursing documentation. And for also you guys, whoever that you're a nursing student, wherever you are, if you watch my video, hopefully this is gonna be some sort of great example for a nursing documentation in narrative form. That's all from me. Thank you so much for listening and watching. See you in the next occasion. Bye guys. Thank you.